A very big hello to all my dear students. So, how are you all? Today, in your T2O series, welcome you to, of course, first a warm welcome to your favorite channel, You and I with Dr. Ruchira. So, today the alphabet is J. What are we going to read here? Can any guesses which topic by J? Yes, we are going to talk about juvenile rheumatoid arthritis. A very quick revision here. If you talk about arthritis, diseases associated with uveitis, the first topic we learn is arthritis associated with uveitis. Now, talking about this arthritis which is associated with uveitis, please note down the points. This is important as an exam. Very important thing, number one. This is, all these arthritis are HLA-B27 associated. This is a very important exam question. Make a Q there. Second important point, they are all seronegative. Rheumatoid factor is absent. Okay? And what is the type of uveitis? All these are in the box non-granulomatous anterior uveitis. I hope you know, you've revised what are the features of anterior uveitis. These are all non-granulomatous anterior uveitis. Now let's learn further that this uveitis may present as acute anterior uveitis or it can present as chronic uveitis. Okay, so when you are talking about acute anterior uveitis, this is seen in three conditions like ankylosing spondylitis, psoriatic arthritis, and what is the next one? We all know Retter's syndrome, right? Okay, so everybody knows the triad of Retter's syndrome. These are all important questions. Of course, it is urethritis, arthritis, and conjunctivitis. The typical triad, we don't say uveitis, we say it is conjunctivitis. Right. So, this was a baseline. Now, you know where you are. Coming to, that is juvenile rheumatoid arthritis. So, under the chronic, we are going to learn juvenile rheumatoid. What's the new name of juvenile rheumatoid arthritis? We also call it juvenile idiopathic arthritis. What are the points to remember? How do you define JRA? Okay. Before we see these clinical slides, few points on JRA and then I'm going to come back to the slides. So when you say how do you define JRA? JRA is what? You will say any arthritis within less than 16 years of age, or juvenile idiopathic arthritis, it is less than 16 years of age. In less than 16 years of age. We divide it further into three types: pauciarticular, polyarticular, and you remember this? Pauciarticular matlab less than 4 joints are involved. Next is polyarticular. Polyarticular is your more than equal to 4 joints are involved. And lastly, it is systemic onset. Systemic onset is also called Still's disease and it starts with systemic features. Okay? Now coming to when you say not all these JRA are all, not all are associated with uveitis. Which one is associated with uveitis? It is mainly the pauciarticular. But let's move further. Pauciarticular can be further divided as early onset or late onset. Okay, so early onset or late onset. So late onset is called type 2 and early onset is called type 1. So this is the early onset, that is type 1, which is associated with uveitis. What type of uveitis? I've told you it's a non-granulomatous anterior uveitis. So this is important as in the exam. Okay, so which type of JRA? It is early onset pauciarticular seronegative JRA. All these patients in type 1, just remember seronegative, RA factor, rheumatoid factor is absent, but they can be ANA positive, and generally they are more common, this problem is more common in females. Okay, so these are some important points regarding juvenile rheumatoid arthritis. But another interesting point, though it is an anterior uveitis, do you all remember how an anterior uveitis presents? I have taught you like 5 fingers: pain, redness, photophobia, blepharospasm, discharge. Pata hai na? Okay. Now what you have to remember here, that all these 5 features are absent. So it's a slow smoldering infection, inflammation. Okay. So eye is not red, no redness, not much pain, no photophobia, no blepharospasm. So how will this child present to you? The child presents only when there are complications like cataract, glaucoma, which can happen after long-standing uveitis. Because there is no redness, have a look. There is no serious redness. This is what is, we call it white uveitis. So other name of JRA is white uveitis. What is white uveitis? White uveitis is atypical anterior uveitis, where those typical features of anterior uveitis are not present. Okay, so it becomes atypical anterior uveitis. To make life simple, just learn the 5 fingers, pain, redness, photophobia. The child is not going to, generally this patient is not going to present with. So how does it present? The patient is only going to present with complications. And what are the complications? Most common that you will remember is, of course, cataract, secondary, complicated cataract and secondary glaucoma, right? Complicated cataract and secondary glaucoma. These two you shouldn't forget. Okay, so here you can see these are synechia which are formed. The patient, the eye doesn't have much of the redness. So this is mainly a case of juvenile. Of course, this is not a typical spot diagnosis slide. It has to be diagnosed only around the whole history and clinical findings. Okay, it's just very important for you to just know this, that redness is negligible or not there and symptoms are not there. It's an atypical anterior uveitis, right? Okay, that's why it's called white uveitis. Okay. So that was about your juvenile rheumatoid arthritis. That is the letter J. Let's solve a question here. The question is, iridocyclitis is a feature of juvenile idiopathic arthritis with systemic involvement? No, that is Still's disease. Seropositive polyarticular? No, it's seronegative. Seropositive polyarticular? Again, it is wrong. So answer is seronegative polyarticular juvenile idiopathic arthritis. Okay? Yeah. So hope you enjoy the session. Thank you so much. Stay blessed and keep smiling. And of course, I will be taking further. I'm thinking to just include first a few quick rapid preparation, rapid revision for the upcoming FMG exam, because I'm getting a lot of requests out there. So maybe then the next letters will be posted further after this revision, right? We are also missing on INICT discussion, which was a question discussion. Because of some circumstances, I couldn't do it, but we will be doing that soon. Okay. Thank you so much. Stay blessed. Keep smiling.